Oops. Hi, Carolina here. I'm making this video so I can answer to everybody at the same time. Today is August 2nd, and I just left my consult with my breast surgeon. And so, a few things first, I guess. No, let me. So, I got my pathology report back. And first of all, my cancer is the best case scenario. It goes from stage 0 to stage 4. Mine is stage 0, which means that I have all these cancer cells, but they are grouped inside of a milk duct, and they're not going anywhere right now, for now. Nobody knows the problem. It's called DCIS, ductal carcinoma in situ. And the issue with it is that nobody really knows which ones will become invasive and create problems pretty quickly and which ones don't. So, with that said, my pathology report from, not from surgery because I didn't have it yet, from the biopsy came back with a couple of things that are questionable still. One, well, first thing, the area is 0.9 to 1.4 centimeters. So she said that that's not big, and it's okay. Probably I will have just lumpectomy. Now the issue here with then after that they test the hormones to see if it's estrogen and progesterone positive, sensitive, whatever. And then they also analyze the form and the shape and how the cancer cells are acting. The problem with mine is that I had half of the biopsy said that I am an intermediate risk or grade, what they call grade for DCIS, and the other half said that I am high grade. High grade means, and the way that it says that it's high grade, it's that it says comedo necrosis is present, and there is something else. Anyways, when it's high grade like this, what it means is that, okay, so comedo DCIS, a type of non-invasive cancer that tends to grow quickly. Comedo refers to areas of dead cancer cells that build up inside the tumor. A sign that the cancer cells are growing so quickly that some of the cells are not getting enough nourishment. And then mine also came with necrosis, which means clumps of dead cancer cells, often seen in high-grade DCIS. The cells are so crowded that some of them do not get enough nourishment and die. This grade, if I am an intermediate grade, I have what it deals with is the chances of this becoming invasive and coming back. So high grade has a very big chance of that. And so because we didn't have this information, we chose to do two tests. One that's a genetic test that, because of my family history, that tests cancer marks for, I think, 29 different cancers, but especially ovary and breast cancer. That is to see if I am BRCA1, 2, or if I have any other risks that we should consider. And as far as hormones, mine is estrogen 100% and progesterone 50%. Now, the options will depend, and I will also do an MRI because I have very dense breasts, and not everything is caught on a mammogram. So just because before the surgery we're going to do the MRI to make sure that that's all we're dealing with. So my options will be really based on these results. Initially, what she's looking at the paper that she gave me is a lumpectomy with, then I have two choices. I will have two choices of radiation if I do lumpectomy. One is you take it twice a daily for 5 days and you're done. And the other one is 30 to 35 treatment sessions Monday through Friday. So 6 to 7 weeks going every day for this. And then on the top of it, 5 to 10 years of a drug called tamoxifen. I think it's a anti-estrogen pill. So my questions for her, let me see if I have. Okay, so will the lymph nodes be biopsy? My understanding from what I heard, and Leah and Lori were both in a conference call, video call with the doctor. So if I am wrong, somebody jump in and correct me. One lymph node would be biopsied. For that, it needs to actually be removed, which was my I had a concern about that because of lymphedema, but she said that the risks of lymphedema with removing only one lymph node is pretty much none. So my options, depending on my surgical options, depending on the tests, will be lumpectomy, just lumpectomy, which is very rare. Lumpectomy and radiation, a unilateral mastectomy, or a double mastectomy with immediate reconstruction. And that's completely my choice. Whatever, if I'm freaked out and I don't want any chance of the cancer coming back. Although she said that even with mastectomy, you can still have breast cancer because it can come back on the skin of your chest or anywhere, basically. So it doesn't eliminate, there is no, what she said is that there is nothing that eliminates your chances of the cancer growing or coming back. It's just working with your best case scenario and the best way to prevent that. So I asked her if, because I had read that quite a few women had the, what's considered stage 0 cancer, which is what I have. And then they decided, they freaked out, decided to do a mastectomy instead. And when they did the mastectomy, they found out after the pathology that they actually had invasive cancer that was already going to not only the tissues around it, but the lymph nodes, in which I wouldn't know if I only did the lumpectomy. She said, yes, it can happen. However, it's very rare. Recovery time. The recovery for lumpectomy, she said it's I have people that are working in a couple of days, working desk work. It's a very easy recovery. It's an outpatient surgery. I will go under general anesthesia, but to exercise about 2 weeks, I can start exercising again. And yeah, I think that's what she said about lumpectomy. Oh, and the shoulder, it could, because I just had shoulder surgery in February. Yes, that could be an issue, but PT would solve that. Mastectomy, she said, it's a much more complicated situation. It's a much bigger surgery. And the advantage is I wouldn't need radiation, I wouldn't need hormone therapy. It's just a mastectomy pretty much, and you're done. But it's a big surgery. She had it herself, and she said it's been many years, and only now she's getting some feeling back, but it's not, your chest pretty much gets no feeling whatsoever afterwards. So what will my breast look like after a lumpectomy? She said you can bear it for a tumor this size. It's not going to be very noticeable. It's going to be it's going to be fine. Now, for a mastectomy, she said that there are some amazing reconstructing surgeries that you couldn't even tell that something happened, especially if you have the opportunity of do skin and nipple sparing. So they do kind of like a tummy tuck. They take fat from your belly and then reconstruct your breasts, and on the same day you have like perfect breasts. I asked her if it was her, and it was her in the case, what would she do? She had the same cancer as I do, DCIS, which is stage 0. However, hers were spread out. It was all over. So she didn't have enough tissue to get it and get enough margin. So she did a unilateral mastectomy. Let me see. Okay, so alternative treatments: high dose of vitamin C infusions, LDN, and hypertherapy. Let's go to cannabis first. Yes, I was very interested on cannabis oil. And unfortunately, I cannot do that because the THC itself affects hormones, especially estrogen. So she said anything cannabis, stay with CBD, vape CBD or take CBD or whatever. It's not, if it doesn't help, it's not going to hurt you. But pot, cannabis oil, she was truly familiar with RSO, which is Rick Simpson oil, and she said no, because your cancer is fed by hormones and you cannot have that. I forgot to ask how long after the surgery do I start radiotherapy. I guess I will talk to her. So the next step for me is she collected blood to do this genetic test, and then in about a week and a half or 2 weeks I will have my MRI. She said because I have very dense breasts, I need to do the MRI at the right time of the month, so I cannot do it in between my periods. I need to do it right after my period, otherwise it can come with false positive, or they're not able to see anything really. So insurance covers all my, there are some tests that insurance needs approval, which for me, I had such family history with cancer that my genetic test will go right through. But aside from that, it will cover everything. I already met my out of the pocket for it this year, so I told her, everything that needs to be done, let's do it this year, because I will not pay a dime. They will make sure they have a person that, thank goodness, they have a person that takes care of all the insurance thing. They make sure that all the labs are in network. They make sure that the hospital is in network. They make sure that the anesthesiologists, the nurses, the oncologists, whoever touches me is in network with my insurance, so I do not need to worry about that. The risks for radiotherapy and hormone therapy. There are risks. The side effects for radiotherapy, she said, they are all superficial, like on the skin, burning and itching, and the skin it's like getting a severe sunburn for some people. And hormone therapy. Hormone therapy is a crapshoot because there are people who cannot deal with it. But these things, both like radiotherapy after a lumpectomy, reduces the risk from like 40 to 50% of recurrence to only 15%. And the hormone therapy reduces your risk of having any breast cancer by half. So it's really a case of risk benefit. And in her opinion, and she is a cancer survivor, it is worth doing it. However, she's going to analyze my genetic and my tumor tests and MRI to see if I need. She doesn't want to over-treat me, and she doesn't want to under-treat me. So if I don't need radiotherapy, then I'm not gonna do radiotherapy. Just the lumpectomy. Now, of course, when they say, well, the choice is yours as far as what surgery you want to do, it's a tough choice. But anyways, I am really looking, as far as cancer goes, at the best case scenario. And it's what I told her. I'm not scared of this cancer, because this cancer is contained, and it's their little, cutie cancer cells all united. We're not gonna do anything. But when it comes back, and if it comes back, the tendency is to come back quite aggressive and quite fast and very invasive. So that is my biggest goal, is to prevent that from happening. Surgery, I got the results in about 2 weeks for both my MRI and my genetic test. And she said that the surgery will happen right there, 2 to 3 weeks. Anyways, that's it. This is a video that's super long. I am fine. I know that everybody gets a little bit, cancer is a very strong word, but I was extremely lucky, and I have absolutely no doubt that this is going to not be. I think probably the biggest deal will be radiotherapy if I need it. But I will get done, I will get through it, and life will follow its course. So send me vibes, but don't worry, okay? Love you all. Get your mammograms.